Okay, we are live. We are going to give it just a few minutes so we get the green light to make sure everything's working. And Sarah, if you can see the chat box too, let me know if anybody there says anything.
So far, no comments.
All right, I can text. We are loud and clear. So hello, everybody. My name is Olivia Huggins, and I'm from iMethods. Just wanted to welcome you to this afternoon's breakout session called Putting the Auto in Autograder. We are thrilled to have Sarah Bolik, Scott Sigmund, and Nick Edwards joining us from Baylor Scott White Health to discuss how they are using Eggplant. Just a couple of quick housekeeping items before I hand this over to the team. You will be able to ask questions using the chat window to the right, and they will answer your questions at the end of the presentation. And all of these sessions are recorded, so if you need to catch up later, you can go back to the event site and view the recordings at a later time. And just be sure to stick around afterwards at 3 o'clock. Right after this, there's a virtual networking session, which is the next session in the lobby. And with that, I'm happy to welcome Sarah, Scott, and Nick. Over to you guys.
All right, thank you. Afternoon. I'm Nick Edwards, a Senior Training Manager with Baylor Scott White Health. Today, I'd like to introduce two of my teammates who have worked extremely hard over the past several months launching Epic's Autograder functionality. First, you'll be hearing from Sarah Bolik. Sarah is a Senior Training Manager with Baylor Scott White Health. She manages the inpatient team and our training environments. Sarah has been with Baylor for 10 years and is an expert in all things MST related. She's overseen the MST build and rebuilds for our organization since 2012. In this project, Sarah led a team of principal trainers through the build of 34 Autograder assessments. Today, she'll be sharing that story with you all. You'll also be hearing from Scott Sigmund. Scott is a database administrator and works on our Epic training team. Scott manages databases that feed information into our different training systems. In addition, he designs, builds, and maintains custom solutions for our Epic training team. Scott holds a master's in management of information systems from Texas Tech and has been with Baylor Scott White for 5 years. Today, you'll be hearing how Scott used Eggplant and a custom application built to automate Epic's Autograder functionality. Let me go to the next slide. All right, so about Baylor Scott White. Now, normally, this sort of slide would be kind of just a formality. However, it does point out an issue that was central to the problem that we were faced with solving. Baylor Scott White is the largest not-for-profit healthcare system in the state of Texas. We have over 49,000 employees, 500 plus clinics, and over 50 hospitals. If you look at that second infographic that points out shows the state of Texas, if you were to overlay the state of Indiana on top of that coverage area, it would essentially encompass that entire area. So our coverage area is over 34,000 miles, which another little fun fact is about 30 plus Rhode Islands. So really what you'll hear within our presentation is that the size of our organization and our geographical dispersity really lay at the heart of the problem that we were faced with solving. Let me go to the next slide. So in today's presentation, what you'll hear or what you'll learn about is what is Autograder. You'll learn about Epic's Autograder functionality, the challenges that we faced with launching Epic's Autograder functionality, the strategy and the approach that we embarked upon to launch Autograder, and lastly, our outcomes and kind of what's up next for us. So with that, I'd like to introduce our first speaker, Sarah Bolik.
Hi, everyone. My name is Sarah, and I'm going to talk to you about what Autograder is and then what our process was that we followed when creating our Autograder build. So what is Autograder? Autograder is a tool that allows Epic customers to assess Epic end users' proficiency in a live training environment. This style of assessing proficiency more closely simulates the actions end users will actually perform in their day-to-day task. Some of our resource requirements that we had when building out Autograder is credentialed trainers or nurse educators who are doing our proctoring would have to manually assign those assessments to end users, manually assign those patients and those logins. Principal trainers or someone who is certified with in that Epic application would then have to submit the assessments for grading once the end user completes it. That's a manual process that entails uploading an XML document into the back end of our Epic training environment and the text environments. Hence, that's the reason why it has to be a certified resource. Principal trainers and or the credentialed trainers or nurse educators would then have to inform the trainee of their pass and fail status and then communicate that information back to our Epic security team. Our principal trainers would also have to upload that score into our LMS system for record keeping. Some of the challenges that we faced with Autograder was creation of the assessments with our limited resources, our geographical spread across Texas, and actually getting to all of those end users the information that they need. And then the scalability across our organization. We are in a fully virtual training mode. So most of our end users take their training either in their own home site or potentially at home, or they come into a proctoring session according to what kind of role that they're in. How do we then assign patients to this vast span that we have, and how do we collect all of those submissions to run them daily? And then also that manual grading piece, we would have to have a resource that can sit there and grade all of these within our text environment daily. So our approach, kind of what was our process for building out our Autograder? So we knew that we needed a fully automated system. And with what Autograder comes to us from Epic, it's not fully automated. There are pieces of it that are automated, but there's still that manual grading piece. So from there, we knew that Eggplant would help us in our automation of it. We then built out our Autograder. So next we had our principal trainers and credentialed trainers build out the scenarios, and then our Autograder team built out those projects. Once we had those ready to go, we realized that request and getting our patient information and our scenarios to our trainees was a little bit of an issue in this fully automated system. So that's when we passed it off to our database administrator, Scott, for the web app development and build out of Eggplant. Once we had all of that set up, we went through a couple of different weeks of testing, and we recently on 9/21 took RoboGrader, which is Autograder. We renamed it to RoboGrader for our fully automated system. We took that live with our nursing partners on 9/21 with 20 different RoboGrader assessments. So we're going to just take a few minutes and actually walk through the process of building out those scenarios and building out those projects. And then I'll pass it off to Scott to talk about the web app and Eggplant portion. All right. So some of our challenges that we had before this was multiple choice questions were just not effective at our organization. After years and years of using multiple choice question and answers, our answers were out there. They could look to a colleague and ask them, hey, how do you document vitals? Their answer was always flow sheets. So multiple choice questions just were not effective anymore for our organization. And we really wanted to get down to a in-system true assessment based on their documentation. So what we did is we started with our principal trainers and our credentialed trainers creating those scenarios for us. So what do we actually want the end users to do to kind of test that they have the knowledge to go onto the floor and use Epic in a proficient way? So our principal trainers and credentialed trainers started with their exercise books. They took those exercise books and they stripped out all of the directional portions, the portions of it that had the helpful hints like go here, go there, stripped all of that out. And then they added in some key pieces that might not have been part of their exercise books before, but were very heavily hit within the CBT. Once those exercises or those scenarios were created, we actually stood up a Autograder team that has an Autograder email account linked to it. And so those principal trainers and credentialed trainers could submit those RoboGrader assessments and scenarios to that email account, and our Autograder team would pick those up and then build out those projects. Our Autograder team consisted of 5 really partial resources. We have 3 PTs who work on this team, and then we have myself and then our database administrator. None of us work on this team full time. This is definitely in addition to our normal PT manager or database administrator work that we do. Those principal trainers would submit those scenarios to the Autograder team. One of our Autograder teammates would pick up that scenario and start creating the project. So how we would create the project is we would actually run through this scenario. So here's an example of a scenario here on the right-hand side. You can see that it starts with how do you get into our environments? We set up a specific RoboGrader environment just for this testing purposes. And our scenarios normally go about 2 to 3 pages long, and they walk through either 1 to 2 patients. If we can get through all of the key pieces in one patient from beginning to end, then great, that's an option. Some of our applications like ASAP and OR, we weren't able to go through everything that we needed to go through with just one patient. So there are times that we're using 1 to 2 patients and possibly 3 patients throughout this scenario. So what we did to create our projects is we did follow the Epic standard Autograder build, but we didn't ask any of those multiple choice of questions where they still had to submit their answers. We built it purely off of the documentation that they were doing in the system. So we would run the scenario on our Kingsley patient, which was, in our scenario, and then we would go into Record Viewer and look at the Kingsley patient we documented on versus a Kingsley patient that had not been documented on, and look for those documentation differences. We would look to see that they've acknowledged their existing orders, they've acknowledged the medications, they've collected that specimen, they've done their blood documentation. We would look for all of that within Record Viewer. We started with the INI of EPT, which is our patient profile. If we were not able to find the documentation linked up to one of those INIs and item numbers, or if one of those item numbers was a virtual item, we would then create CER rules. A great example of this is flow sheet data, blood administration, care plans. A lot of those were virtual items within the patient record. So we had to create CER rules for those. We would then document all of that onto our build tracker. So we had our project, our field, which our field always equaled a patient. So what patient are we using for this scenario? And then our assertions. As you can see here, our blood documentation is all CER rules. And most of the time, for blood and vitals and things like that, we're using last flow sheet values that are documented so we can pull that last value. Because most of the time, because these are training patients that we're using to do this testing, they already have some documentation on them. So creating that CER rule still allowed us to pull those last values that the trainee just entered. So we would build out everything onto our project tracker, and then we would build those projects out into text. Once all the projects were built, we then leaned on our credentialed trainers again to run through the scenarios for us. They would submit what name of the patient that they used to us, and we would manually grade that within text within the Autograder typical build. That's the piece of it that we automated with Eggplant, that manual piece of going in there and grading it. And Scott will talk about that a little bit more a little bit later. But by doing this, we are grading purely on the documentation that someone is actually putting into the environment, not based on an answer that they're giving or on a multiple choice question. So after we did all of our testing and we knew that our scenarios were working great, our projects were working good, we were getting the appropriate grades that we needed to get, it was time for us to figure out, how do we really get this information to our end users? How do we get, how do they request to have a patient so we can actually give them a patient and a login? How do they submit that they've done their scenario on their patient? And then how do we get results back to them? And for that portion, I'm going to pass it over to Scott to kind of lead us through the web app and the Eggplant development that he did.
All right, thank you, Sarah. As Sarah said earlier, one of the biggest challenges that we faced was how to implement Autograder into our existing training structure. We didn't have the resources to manually request Autograder assessments, and we could not afford to have our principal trainers manually submit completed assessments for grading. Thus, we decided to use Eggplant and build a custom web app to overcome the resource constraints. What you're looking at here is our Autograder assessment request form. The form is accessed in the curriculum assigned to the student in our LMS Cornerstone. The student will simply click a button labeled Launch Assessment to begin their Autograder assessment. Once it's clicked, this form will appear. Now, we allow the students to either take an Autograder assessment test out or the regular curriculum for the Autograder. We allow the test out, which is an assessment without any curriculum, to allow students that have come from other organizations that use Epic to kind of fast track their way through their certification for Epic activation. So the form that you're seeing here is one part of our web app, and it replaces the need for trainers to assign RoboGrader assessments to students. On the front end, the student enters their information, their username, their full name, and their email address. On the back end, we assign the student a training login ID and patients to use for their Autograder assessment. That's done using a database query to ensure that we can A, associate the student with the training login info and the patient sets, and B, it prevents us from assigning the same login info and patient sets to multiple students. This way, we can assure that we're able to capture the grade for a specific student, even though they're using a training login and test patients in our training environment. There's some other things that happen in the background to ensure that students don't request the same assessment more than once before submitting it, but I won't get into that at the moment. However, without this functionality, our credentialed trainers would have to record this information manually via a spreadsheet, and they'd have to be careful not to assign anyone the same training login or patient sets. If you could go to the next slide. After the student enters their information and the app has assigned the Autograder training info required, the app then emails that information to the students. Here's an example of the information that the students receive. The assessment information will appear on the screen for the students to see, and the student will receive the same info at the email address that they entered. This kind of allows students that access a Gmail account or any other account more often than their Baylor account to kind of get that information to that email to allow them to work from home and take their training at home. And you can see here, you can also see the login info that the student will have to use, as well as their test patients that they will need to use in the assessment. In addition, there's a review scenario button, which will download a Word document of their review scenario that they'll use to complete. There's also a button to open Citrix, which will open the RoboGrader environment for them to start their scenario. Once again, this information pops up on the screen after the student submits their info, and we email it to them. The email ensures that the student has the assessment information in case they accidentally close the window by chance. Next slide, please. Now, once the student has completed their Autograder assessment, they will use this submission form to submit their assessment for grading. Once submitted, we simply mark the assessment as submitted and note the attempt number. We use that to kind of make sure that they don't go over the number of attempts that we allow them to take before we notify them of other instructions for continuing the training. Without the custom app, a trainer would need to email the spreadsheet containing students' assigned login info and patient sets to the principal trainer. The student would then have to wait for the principal trainer to manually submit that assessment for grading. I should also mention that on this step, we also check a name of one of the patients assigned in the scenario as a safety measure to ensure that the student uses the correct patient assigned to them in the assessment packet. Next slide, please. Now, here's where the magic happens. Thanks to Eggplant, we were able to create multiple Eggplant scripts with the help of our Eggplant resources, Ann Foster and Francesca Trumbly, to automate the process of submitting Autograder assessments for grading. Eggplant runs every 5 minutes from 7 a.m. to 10 p.m. every day using the Eggplant Manager feature. It's down from 10 p.m. to 7 a.m. for our Epic environment to refresh. That being said, every 5 minutes, Eggplant grabs any submitted assessments, and then it submits those assessments for grading in the back end of Epic. Here, Epic has replaced the need for us to dedicate Epic credentialed principal trainers to manually submit Autograder assessments. In addition, Eggplant is able to submit these projects for grading much quicker than your average human or principal trainer. Eggplant will not get overtasked with other projects regarding quarterly bundles or becoming too busy assisting other students and Epic teammates, or any of the millions of other things that we ask our principal trainers to do on a daily basis. Here, Eggplant runs 180 times per day between 7 a.m. and 10 p.m. Thus, in addition to circumventing the need for a certified Epic team member to submit these assessments for grading, we're also able to submit our assessments more frequently and on a regular cadence. This helps us better set expectations for our students, and they know when and where to expect their assessment results. The next slide, please. Now, once Eggplant has finished doing its magic, the student will receive an email with the results of their assessment. There's also a place on the web app for that student to review their status. The student is notified if they pass, fail, or exceed the number of attempts allowed. If they exceed the number of attempts allowed, then they are sent instructions on next steps in the email that they receive. So that's it for my part. I'm going to let Sarah talk about the outcomes of our project.
Thank you, Scott. So with implementing Eggplant into our automation process and our projects and scenarios that our principal trainers and credential trainers created, we were able to implement this with a small team building out those projects of 4 Autograder team members and 1 database administrator. We only have a total of 8 principal trainers who are working on this for the whole inpatient side. And really only a handful of those were working on these for our nursing go live that we did on 9/21. We did take 20 of our nursing Autograder assessments live, and we have had over 180 submissions in the past 2 weeks with this go live. So our assessments are based purely on actual documentation within Epic. As Scott showed, we're only asking them for 1 patient name that they use during their scenario. We're not asking them to enter in any other kind of documentation within that, just really what they documented in this system. And even if they do fail on their first try, they're not having to go through the whole scenario over again. Part of that patient set when we're sending that out there is when they request it for the second time to take again, we're giving them the same patient set so they can just look over the documentation they already did and make edits to those areas that they missed. Through this whole process, we did build out 34 total Autograder assessments, which the other 14 were for some of our allied health areas and for our provider side. With RoboGrader, we are being able to grade every 5 minutes instead of daily with Autograder, and we're able to get those results back to our end users quickly, and then we get those results sent over to our security team 3 times a day. So just like our multiple choice assessments, it's almost that automatic grading, and then that gets over to our security team. We're still in line with that instead of going to a daily routine. And with this process, we have truly set up a full virtual solution for us to do this Autograder assessment. I don't need a resource to be here every day to grade these. It's completely automated with the use of Eggplant. So what does our future look like? Really, nursing is really our pilot for this. So our future is to integrate our passing score into Cornerstone automatically instead of a weekly upload. We want to start using the data that we receive for what people are missing most often to help improve and also recommend different education to our trainees. We would also like to start using this for our proficiency assessments as our end users continue through their proficiency continuum here at Baylor Scott White. Our providers are going to be doing a lot around value-based care. So we're also looking to use our RoboGrader assessments to evaluate that value-based care. We have also had some interest in our simulation-based training assessments from our nursing staff and some of our front-end staff as well. So as they're doing their simulation training, to do that documentation within our environment, and then for that grade to also come out for those simulations. We're also looking into team-based assessments. So how can we use this RoboGrader feature with Eggplant, the web app, and building out of our scenarios and projects to really see how everything works within a team-based area. So from the frontline staff to the nurse doing her work to the provider to that patient being discharged, and really see that whole true team-based care. So that's kind of where our future is going with this. We have a ton of interest in our organization around this automated system, and we are highly looking forward to continuing our growth of this program. So resources that we use, we just want to give you a little quick tidbit on that side. We did use the Autograder build tracker that Epic provides, along with some of their their standard Epic build in there. We used Eggplant and then a database with a custom web app. And some of our resource needs, it did take us about 10 hours per assessment scenario for creation from our principal trainers and credentialed trainers, about 40 hours per assessment to actually get that project created, to do that data mining within the record viewer, find those items, make sure that those items actually worked, create those CER rules. So it was about 40 hours per assessment. And then for our testing, it was about 8 hours per assessment because we did our testing just on the project itself. And then we did our testing going through the request and submission and full grading process with using Eggplant. And our credentialed trainers helped out greatly with that. So, and our principal trainers as well. It was about 160 hours for our database and web app development and testing. And then about 10 hours for that Eggplant development and testing to hook all of this up together. So what questions do y'all have for us?
Yeah, and before we jump over to those questions, I do want to also just point out that, you know, it's definitely a lot of work to stand up Autograder in addition to, you know, kind of doing the automation work as well. And just want to give a quick shout out to some of the other team members that were engaged in this work. I should also mention during the same time frame that we were dealing with all of the COVID related, you know, training needs, as well as launching quarterly bundles and other ongoing, we'll just say, implementation needs within Epic. So a quick shout out to Fabian Bucio, Mia Hardister, Caitlin Kalina, Nina Tika, and Chris Shukru. So just thank you for all of your guys' hard work on this project. All right, so let's see. Questions regarding just questions about Autograder in general or any of the automation work? Good question from Brent. Sarah, you want to take that?
Yeah, so 3 lessons learned when implementing. So far when implementing, we have discovered that not everyone can actually type in their email address correctly. So we have actually added in just last week a confirm your email address, and that those two actually need to match, because we did find that was a little bit of a hiccup the first week. A second lesson learned would be when actually taking these assessments, they really do need to be on the network to get to our Epic environments through our Citrix and everything like that. We discovered that due to COVID, a lot more people were taking this training from home and sometimes on their personal computers. So we had to beef up a little bit of things to give instructions to make sure that they could get onto the network to take this assessment. Scott or Nick, do y'all have a lessons learned from y'all side of the house?
Yeah, I'd like to share at least a couple of them too. So one, testing. Once again, with working within the Autograder environment, and essentially it's just a huge kind of reporting solution. So trying to do as much of the testing that you can is going to be really important. The second thing that I think that, I don't know if it would be a lesson learned, but maybe at least a takeaway is that, so we built a custom solution that met the needs of our organization. For others that maybe were looking to do so, you know, once again, we use an asynchronous mode of training where trainers aren't always, we'll just say next to or available, I won't say available, but next to the students. And so, you know, that kind of really drove, once again, our solution. But for others that are looking to implement Autograder, once again, the Eggplant solution, which really replaces that need for principal trainers or a certified staff, someone that's certified within Epic to do those submissions for grading. That was something that we were, you know, Lee Laverne kind of turned us on to Eggplant, let us know that it was available within within our organization. And that piece right there really helped us to kind of, really engage and even consider implementing Autograder. So for those looking to implement, I would say that having access to something like an Eggplant solution is really gonna make this a scalable solution for your organization. And then, as Sarah mentioned, just trying to consider all of the different ways that your customer or your students will be accessing the training. So as Sarah mentioned recently, more of our students are taking the training from home, as opposed to previously they were taking the training from their home work location, right, as a part of their department orientation. And so having some sort of, Citrix solution or something available so that once again, people can continue to access your training remotely and access all of the components that they would need to go through the Autograder assessments is definitely a must.
Yeah, the other advice I would give for someone who wants to implement a similar solution is you can do the basic Autograder build that Epic provides to you, but we didn't want our end users to really have to give us any of the answers. We wanted to see, what they could do in the actual environment. So working heavily with your principal trainers and those credentialed trainers and getting, different sets of eyes on the scenarios and people running through them was very beneficial to us. Like Nick said a little while ago, testing. I think one of the great pieces that we had in there is our credentialed trainer and patient team. I borrowed 3 of them, every other day to kind of jump in there and test out different scenarios. Some of them didn't even know the application that they were testing, which actually proved to help us in a lot of ways because they were able to find some of those hiccups and some of those, typos within our scenarios or, something that needed a little bit more direction for us because they weren't as familiar with it. But it actually gave us more of that insight of a true end user who's just learning Epic and they've watched their computer-based training or now sitting down in the environment, sometimes for the first time to take their assessment. So using those credentialed trainers for testing was a great resource for us because they had a broad kind of span of knowledge for the different applications. I think we have just a few more minutes. Are there any other questions?
Sarah, there's one thing that I think I've spoken to you offline about this, but I'll also point here too is, your strategy of how you pull together a core group of principal trainers to build out those Autograder assessments, I think was smart, really smart for lack of a better word. Once again, being able to use that group to not only kind of consolidate the build and not have too many hands in the pot, but also to be able to kind of use them as a force multiplier. Once again, with coronavirus going on in our response to that, ongoing needs with quarterly bundles, et cetera, being able to operate with that kind of strategic group of principal trainers, I think was a very key aspect of the project and really allowed it to, us to hit our date, to hit our go live date.
Yeah, you're exactly right, Nick. Really having that small group actually building out the projects. Since we were all new to building out Autograder projects, we were able to, quickly jump on chats together, Teams videos, things like that, and kind of work through different solutions. And as we found, a lot of the documentation within some of our nursing applications can be used across the board. So being able to share that information with each other, it kind of made our data mining a little bit quicker to create those projects once we got the first few working on it.
Yeah. And Steve Dribbeck has it opened our eyes to possibly incorporating into other projects. I think absolutely. You mentioned that Autograder functionality was new to us when we started this project, but so was Eggplant as well. And I know that Scott leveraged those Eggplant resources heavily. They provided a great training to kind of get us up to speed to do what we needed to do with this initial project. But I think that the more that we work with Eggplant and, once again, seeing some of the presentations that were presented here today, I think it's starting to, the wheels are spinning, they're turning, and giving us some new ideas on how we might be able to incorporate Eggplant in other parts of what we do as an Epic training team.
Yeah, so Steve, one of the ways that the wheels are spinning in my head with my background with MST build is how can we use Eggplant to help us with our MST build? Our normal MST build takes us 6 weeks. So how can we use Eggplant to help us to make that a little bit quicker for us? And then I think there's some other avenues that we can definitely potentially look at using Eggplant for. Maybe even in the assigning of our curriculum that we do on a weekly basis with our new hires. That's a very rigid kind of work that we do that we could potentially spread Eggplant into that realm as well.
Awesome. So I know that we're coming up on time, and I think we've gotten maybe down to the bottom of the questions. I hope that we've given some good information for those that are looking to implement Autograder, and then also maybe giving a couple of ideas to other training teams out there on ways that they might be able to implement Eggplant or other automated solutions into their training ecosystem. With that, I don't know, any closing words, Sarah, Scott?
I would say if y'all have any questions or if this is something that y'all are looking to want to try to implement with your organization, just feel free to reach out to us. We're here to help.
Yeah, definitely.
Thank you, Sarah. Thank you, iMethods, and thank you, Eggplant, for giving us the opportunity. You all have a great day.